Praised as an amazing and caring person by friends, 57-year-old Patricia Dowd died at her home in Santa Clara County on February 6th. Dowd had no underlying health conditions but was only mildly obese. Forensic pathologist Judy Melinek read her autopsy report.
She has a perfectly normal-sized heart at 290 grams. It doesn't have any abnormalities of the coronary arteries, and there's no cholesterol in her blood vessels, meaning that you wouldn't expect a heart like that to rupture.
Santa Clara medical examiners had questions about Dowd's death and saved her tissue. The CDC later examined it and determined COVID-19 had infected her heart, trachea, lungs, and intestines, making Dowd the earliest known death from the virus in the United States.
The virus has entered the bloodstream and has circulated and damaged the heart muscle directly. So the damage has occurred to the heart muscle cells, and the body's immune system is trying to clean them up. And in the process, they weaken the muscle. So with every pump, you're putting pressure on a weakened state, and it can then fail or tear open.
This is where the autopsy took place. Public health officials have said testing shortages delayed the CDC's diagnosis by 2 months. But further CDC testing did help determine another 2 COVID-19 related deaths in Santa Clara County, a 69-year-old man on February 17th and a 70-year-old man on March 6th.
The disease has been around in this area longer, much longer than previously thought. So some speculate January, could have been earlier than late January. It's not known, but you're dealing with uncertainties here, especially since, unfortunately, testing was not readily available in the United States.
Clark says it's important to keep investigating cases, even retroactive ones, for contact tracing.
So part of the objective early on is to identify people who may have been exposed. This person went to XYZ Park. And anybody who has gone to that park around that time might want to go get tested with the antibody to see whether they have developed some kind of antibody response or immunologic response, or to see whether they're an asymptomatic carrier.
Knowing the specific findings from these autopsies, from the ones that have been reclassified, would be very helpful for other pathologists to recognize insidious infection in their own populations.
Melinek says it's especially important to look back with a careful eye for signs of the virus that other cities and communities can spot early on to help contain future spread. Mark New, CGTN, Santa Clara County, California.